February 11th. And we have in for just an introduction on a bill that he has introduced, wanted to tell us about, and unfortunately wasn't able to make it in last week when we kind of did walkthroughs of bills that people had introduced. So Representative Casey, if you'd like to come up. Just to let you know, we're very casual in this committee. We use first names, so.
All right, off the tie. Well, it's great to see everybody today. My name is Connor Casey. I'm the representative from Montpelier. Welcome to the district. And I apologize for not coming in earlier. I was down with the flu, like probably about 50% of our colleagues over the last couple of weeks. It was a rough one. Yeah. So I appreciate the time to come in and talk about H102, which is about regulating healthcare sharing plans here. And I actually took notes for my testimony, which I don't do, but I get a bit abstract if I go off script here. Interpretive dances, that type of, yeah, okay.
You mean, are you saying we can interpret it?
So thanks very much again for the opportunity. I want to talk about healthcare sharing plans. Often they're also called healthcare sharing ministries, and generally would have a religious affiliation with them. But they tend to market themselves as an alternative to health insurance. And they do. They resemble health insurance in many ways, but they're not insurance. And that's the important distinction to make. They're not required to cover medical claims. They're not subject to regulatory oversight. And they often leave their members with substantial medical debt after necessary treatment. These organizations, which are prevalent across the country, frequently exclude critical services like reproductive health, mental health, HIV treatment. They impose restrictions that the Affordable Care Act does not allow, like pre-existing condition exclusions. Yet brokers, motivated by high commissions, they aggressively market these as low-cost options that mislead consumers. They really do, particularly small businesses, into believing that they provide real coverage. And just to give a snapshot of how aggressive this is, as I started researching this, you know how they can say on like Facebook and stuff, like what you're looking at. I've been having tons of ads pop up for healthcare ministries every day, and you can see how aggressive they are. So it was interesting. I was able to experience it a little bit myself, and I've got some photos I can share with people at some point if you'd like to see those. So the problem really here is we don't have clear data of how many Vermonters are enrolled in these healthcare sharing plans, or how much money these organizations are collecting from them. What we do know comes from Colorado, which was one of the only states that recently passed legislation that required transparencies around these to disclose their enrollment numbers, financial data, and marketing practices. With that law revealed, it's interesting because it crosses states. So that law revealed that there are at least 11 healthcare sharing ministries or plans in Vermont right now. But we don't know too much about them. And that's only because Colorado did this. We didn't know they exist at all. The real numbers could be way higher than 11, but we won't know until we regulate them. So that's exactly what the bill seeks to change. It doesn't ban healthcare ministries or plans, doesn't restrict religious participation. It simply requires them to report very basic information to Vermont's Department of Financial Regulation, just like Colorado does. So under this bill, these plans will be required to disclose how many Vermonters are enrolled, how much money they're collecting from Vermonters, how much, if any, of the money is actually going to members' medical costs, and what their contracts and marketing materials say so consumers can understand exactly what they're signing up for. It's all about transparency. Right now, we're in the dark on these organizations, but in 2020 alone, we know nationally that they brought in over $1 billion in revenue. Here in Vermont, we have no way of knowing how much is collected or how much is used for administrative cost or profit. So I was like just looking at some of these contracts from other states, and if you don't mind, I just want to read a line verbatim. It explicitly states, we do not share needs for sexually transmitted diseases, including HIV virus and or AIDS, when contracted through irresponsible behavior such as sharing needles for legal or illicit drugs. It is the member's responsibility to explain how the disease was contracted. I just find that pretty egregious. Like, let that sink in, right? Like that, and that's verbatim from one of these contracts. So the Department of Financial Regulation has already issued consumer protection warnings against the risk of these. And national media outlets like NBC, they've done some pretty big pieces on this, covering the harmful effects. NBC's reporting highlighted how pregnant women were being deliberately targeted for enrollment, only to discover after they gave birth that they weren't covered due to a 12-month waiting period for maternity care.
God.
Right? It goes on. So Oregon regulators even referred cases to the federal government on this after finding out that they were actively recruiting in maternity clinics. So if we look at Massachusetts next door, they collected data showing that each one of these plans, reporting to them, operates in nearly every other state in the country as well. That's why I think it would probably be a lot more than 11 plans in Vermont here. In rural states like Wyoming, Idaho, Alaska, enrollment of these plans is alarmingly high, sometimes making up a third or even half the size of the ACA compliant market. I just wrote down, I'm good with anecdote stories. So here's just an example of, something that could happen. So Jane, 35-year-old single mother in Vermont, owns a bakery. She's in good health, but money's pretty tight. So she can't really afford regular health insurance. She goes to someone who tells her about a faith-based health plan that costs about half as much as an ACA compliant plan. And it sounds like a great deal, He reassures her that the ministry shares medical expenses, just like regular insurance does. So she signs up. What the heck, right? A year later, Jane develops breast cancer. She schedules surgery, chemotherapy, assuming that her plan is going to cover the costs. But the bills start arriving. And that's when she finds out about the pre-existing condition loophole. She realizes the plan doesn't cover pre-existing conditions for the first 2 years, even though she didn't have cancer when she signed up. The ministry claims it existed before she joined, so they deny her claim. When Jane rereads the contract, she notices something she missed. The ministry only covers up to $50,000 a year for cancer treatment, but her medical bills exceed $200,000, and that wasn't disclosed when she signed up. And then she sees another, and this is a common clause, the moral lifestyle clause that requires members to live by specific religious guidelines. Jane had a glass of wine for dinner a few months ago, and when she mentions this with her medical history, they claim alcohol contributed to her illness and refuse to share the costs. So Jane doesn't have any legal resource here. It's not regulated like insurance. There's no appeals process. She's out of luck. And now she's drowning in medical debt, having breast cancer. So the takeaway for this, that's my script, is, this is something that is growing across the country, and I assume it's growing in Vermont. But despite the number of people it affects, the repercussions of this can have a really real and immediate impact on somebody's lives. And as government, I don't think it's our job to say that somebody can't join one of these plans, but it sure is our job to regulate them and make sure they're being good actors and that all the information is on the table so people can make an intelligent decision about their healthcare when they sign up for this. So that's what the bill does in a nutshell. I'm sure I'm missing stuff with Jen there on the side. But I'd really be proud if Vermont was the second state to take legislative action on this and just say, that's not okay. You can't be doing this.
Do we have any idea how many Vermonters? Is there any data at all?
Well, we only know there's 11 ministries. There could be 30, there could be 50, yeah.
How do they get? I have a question for Jen, but I'm gonna go with Deb first. Deb
Sure.
has a question.
I'll get in the queue. Do you have any positive outcomes, payments?
I haven't come across them. I don't want to. Sure, certainly, yeah.
We do a MediShare. My husband was he had COVID pneumonia, was fully intubated for 23 days. In the hospital for 46. And we filled out all the paperwork. The original bill, so he was in New Hampshire. The original bill was like 450 something thousand. Because we're a self-pay, and they knocked down to like 175,000. We got the paperwork into the MediShare, and they called to make the payment. But COVID relief had already paid it, but they were going to pay out the 175,000. we had to pay $5,000 deductible. But they were willing to pay that. And so, 5,000.
That's excellent.
So,
And you know, what I would say is, I'm sure there's some pretty good actors on this, right? I'm not saying everybody's sinister who does this. I'm not saying everybody's predatory. And I'm not saying like they have ill intent, you know, maybe there's some really good people putting this together, but I think it should be regulated just like any other health insurance. There's predatory insurance companies too, right? We regulate them. It's,
Leslie,
I was just wondering, I haven't read the bill, sorry, but
it's okay. Yeah.
has the Attorney General with Consumer Protections had any cases presented to the office?
I would need to look at that. I did, I was able to see the Attorney General a couple of weeks ago and just put this on her radar. So I think she was interested in
Okay.
having some further conversations about it too. So I imagine she probably would have told me if there had been something recently, but
No,
yeah.
I don't think she's
Yeah.
listening. Yeah.
Alan?
I got a question. These ministries you're calling them, are these like individual brokers? Are these businesses or a little bit of everything?
It could appear in many forms, I think. You know, again, like small businesses would sometimes be the ones targeted for the plans
No, but I meant
from the
first,
ministry.
The ones selling these plans, the brokers or the ministries, you know, like say, are they individuals? Are they like a broker that's to sell you insurance and then
I believe they could be both.
could?
Yeah, I believe they could be both.
And would there be a cost to these people once they register to file all their data?
I mean, I'm sure there'd be a cost associated with the work that they put together to get the data to
Then
financial
nothing that
regulation,
The state is going to say, you got to pay us this.
but it's not a tax. No,
Okay.
no, it's not a tax.
I think I have a question. I have a couple of questions for Jen, maybe.
I'm happy to get off the hot seat, Madam Chair.
Just because how does this exist if they don't have, like a minimum essential coverage through the ACA? What?
Jennifer Carvey, Legislative Council. They are not health insurance. They are not, so
Okay.
they are acknowledged in the ACA. They are permissible under federal law. But they are not insurance, so they do not have to provide the minimum essential benefits. You may want to hear from DFR as well. I know they've had some regulatory actions
Okay.
involving some of these organizations.
My other question is around Act 111 that we did last year.
Mhm.
So I know it reminded me when Representative Casey,
I'm informal too, Chair.
when he was talking about coverage for certain things, which really can only be acquired from the medical records. And we did work in Act 111 around prepayment review of medical records before a claim is considered, but that would have no effect on these because they're not technically insurance.
They're not health insurance and they're not health insurance companies, so they're not regulated by what you did in Act 111.
Okay. So if they have the appropriate release of information, they could request any kind of medical documentation.
Yeah, I mean, the patient could authorize release of any.
Did you have a question?
Yeah, I have a quick one, I believe. How do they exist? I mean, are they just in thin air? It seems nobody regulates them. They're not insurance. What are they?
Yeah, it's kind of like a similar question I was asking myself as I was researching this, so I was sort of going down the rabbit hole when I got the Facebook bombardment of ads there and I signed up to receive more info. They do have they have there'd be a PO box associated with it and everything. I believe they have a staff in some cases. Even though they're operating in Vermont, I don't think that means they're based in Vermont necessarily. Some of these are big national ones, right? So, yeah, the more I learned about it, the more mysterious it was, which made me think the more we need to regulate these. Yeah.
When you used the term ministry, what did you mean by that?
I would say a religious affiliated group. Yeah. And that's where I found most of them would have a religious connotation with them. Yeah.
Yeah, okay.
I don't know if there may be some operating without that as well. I believe there are. Yeah.
Great, thank you. Oh, I'm sorry, but our
Sure.
healthcare advocate,
Make a comment, Mike
Yes.
Fisher, healthcare advocate. When we were looking at contemplating an individual mandate penalty way back when, there was a work group that spent a lot of time on thinking about the pros and cons of all that, and healthcare sharing ministries came up at that time as something to deal with. And so that's the last time I can recall any evaluation, looking and trying, attempting to come up with some count of the number of Vermonters that were impacted. And I'll just add as an editorial comment, we get, it is not uncommon for people to call the healthcare advocates helpline to say, hey, there's something wrong with my insurance, something's not working. And we find out that they have scam insurance or a healthcare sharing ministry that is not serving their needs. It's not to say that it doesn't work for other people, but it's a fairly common occurrence on our helpline.
all right. Oh,
So you have a list of providers?
Of sharing ministries, I don't know whether we can back into cases to see whether we know
I'm
more
just
about
curious.
who's here.
I don't know of these at all. This is-
But I think this bill would serve the purpose of helping us know what's coming up.
that was kind of my, and this bill doesn't eliminate them, this bill doesn't do, it just provides oversight from DFR,
That's all it does. Yep.
Requires reporting.
requires reporting.
Just
Okay,
before-
Leslie?
So I'm wondering two things. One, do you have data on those questions from your helpline that you could let us know there were X number in the last Y amount of time? That we can at least start with a little bit of baseline data from you?
Yeah, I need to give the canary in the coal mine comment, that of the universe of people with any individual problem in Vermont, how many of them know to call the helpline? Probably relatively small.
That's true.
And so we provide good insight that there might be a problem, not a great count of the number of Vermonters facing.
So that leads to my other question, if I may. How do we know who's out there? How do we find them? That was my quote.
That's.
Is it deep in there?
Well,
That's what DFR would do?
That's basically what it does, is requires them to report. So they will identify themselves to the Department of Financial Regulation.
So in order to do business, they have to report to the DFR. Is that sort of a?
Yes.
The reporting, how often?
Oh, I think it puts it in sync with insurance companies. So I might.
It's annual.
Yeah,
Okay.
yeah.
I didn't want it to say report and then
Every Wednesday, yeah.
We can, you're.
All right.
Walk through.
Thank you.
I really appreciate it, folks.
Thank
Back to prison downstairs.
Thank you.
Correct.